So we are going to our second keynote speaker, who's going to make a virtual presentation. That's Prof. Beatrice N. Kihara. She is the immediate past president of the International Federation of Obstetricians and Gynecologists, contingent chairperson of WHO Partnership in Maternal, Newborn and Child Health Care Professional Associations 2023 to 2026, and President Emeritus of the African Federation of Obstetricians and Gynecologists, past President of the Kenyan Obstetrical and Gynecological Society, Honorary Fellowship of the Institute of Obstetricians and Gynecologists of the Royal College of Physicians, Ireland 2023, Honorary Fellowship of the Indian College of Obs and Gyne 2022, Honorary Fellowship of the College of Obstetricians and Gynecologists, EXACOG, Senior Lecturer, University of Nairobi, Department of Obs and Gyne, and Consultant Obstetrician and Gynecologist in Kenya. So Prof. Kihara, may you please share your presentation? Thank you.
Thank you so much. I want to really appreciate the invitation from Zimbabwean Society of Obstetricians and Gynecologists to this annual Congress. Distinguished chief guest, senior government officials, Zimbabwean Medical Association, representatives of the universities in Zimbabwe, pediatricians and surgical societies, past presidents, and the current president of the Zimbabwean Society of Obstetrics and Gynecology, the Honorable Secretary General, the Executive Council, Scientific Program Committee, colleagues, partners, public and private sector represented, all protocols observed. I'm really pleased to be here and really pleased to even hear what the chief guest has had to say and the first keynote speaker, coming from Africa and from Kenya specifically. We do have very similar trajectories. Standardizing practice to improve reproductive health outcomes. It is an honor, and I also perceive it as a responsibility to address this gathering as we reflect critically on our shared mission to ensure every woman, every newborn, everywhere, not only survives but thrives to transform society. Sustainable Development Goals is not waiting, it's fast approaching. And it's an imperative we confront the persistent challenges, not only in Zimbabwe, but in sub-Saharan Africa, because we remain off track. Maternal mortality rate should be less than 70 per 100,000 live births. Neonatal rates should be less than 12 per 1,000. Under 5 mortality should be less than 25 per 1,000. Where are we? And can we reflect on strengthening the maternal neonatal dyad? But I always ask and often ask, which woman and which neonate should you select to die? None of them should die giving birth. And therefore we must have renewed urgency and innovations and accountability to them. This morning, I had the privilege to listen to excellent presentations made by Drs. Verega and Goodman Josiah, who updated us on neonatal intrauterine advancements. And this gives me hope that not only are guidelines being implemented and contextualized into our countries, we have hope that women and children are taking the center stage as they should. But we also recognize there are disparities across provinces, the various socioeconomic groups and service levels that expose our systemic weaknesses in the workforce capacity, resource distribution, and even in some cases, lack of adherence to standardized guidelines which are evidence-based. To this trajectory, we must embed quality, safe, and respectful care at the heart of reproductive health service delivery. The leadership of the Zimbabwean Society of Obstetrics and Gynecology is pivotal towards this transformation. And as the custodians of reproductive maternal and newborn health, you occupy a unique position at the intersection of clinical care, education, research, and policy influence. Your expertise and authority shape standards of practice, guiding even the next generation. And you heard this even from the previous keynote, to drive accountability within the health system. The path should be equity, quality, respect. And it begins with our leadership at societal level, anchored in evidence, ethics, and empathy. At the recent FIGO Congress, less than 2 weeks ago, we had the release of the consolidated WHO FIGO ICM guidelines and implementation tools for prevention, diagnosis, and treatment of postpartum hemorrhage. This was a turning point, as it exemplified the growing importance of aligning national protocols with global evidence and the need for professional team culture, and address to multi-country evidence, including from this continent. These global standards must be contextualized and operationalized within Zimbabweans' realities, ensuring that in every health facility, rural or urban, delivers consistent life-saving care. Standardization of clinical practice should be supported by training, mentorship, and monitoring, powerful levers for improving outcomes and ensuring equity. But this cannot happen without a resilient health system, which should be well-supported, distributed, and well-motivated staff, the heartthrob. We need to acknowledge we must address continued competence, address the brain drain, and the clinical welfare of health practitioners. Our human resource agenda must address the workload to workforce imbalance. So the obstetrician, the midwife, the nurse, and community health workers deployed effectively with a skill mix fit for purpose in a growing globalized health ecosystem. This can only be done with interprofessional education, joint simulation, and MNOC training and shared decision-making frameworks. It's only by valuing the complementary competencies of each team member that we can continue providing continuous and safe care. To sustain these gains, we require innovative financing, strategic procurement mechanisms, and programmatic delivery that is integrated, cross-learning with countries, and facing similar constraints to accelerate adoption of proven interventions. Additionally, digital transformation, real-time capture and data analytics with electronic health records and mobile health platforms to enable timely decisions, surveillance, accountability, and resource prioritization. Digital tools empower frontline workers, enhance maternal and perinatal clinical and death audits, and strengthen supply chains, especially in this era of geopolitical shifts, humanitarian crisis, socioeconomic downturns, and reduced official assistance. Ladies and gentlemen, I do not want to belabor more, but I think we have hope for a change in Africa. And why do I say this? We as the health sector should think very seriously of working with other line ministries and partnerships, particularly public-private partnership. This has been echoed in the new public health order, the Accra Reset, and at the current World Health Summit, which I am currently engaged in. It is vital in standardizing and improving reproductive health outcomes and address both social and commercial determinants of health. Collaboration between the Zimbabwean Society of Obsgyn, Ministry of Health, academia, civil society, and development partners to enable translation of global standards. We have had, even in Africa, moments where we were at the center stage of innovation, To mention a few, some of them I may not pronounce very well, but we have Mushonga Wegonzo, herbal decoctions for fever and infections in Zimbabwe. We have the Mufandichimuka root, used for postpartum healing and menstrual regulation. We have documentation even of medicinal plants by Professor H. Wild. Safe motherhood models, early integrative, pluralistic health systems in Zimbabwe, to mention a few. Again, we have the Philpott Patograph of South Africa. We have, the list goes on, that we have what it takes, even within our setting, to reconjure up address to what is locally grown solutions and placing guidelines that are also relevant to within and with our context. Ladies and gentlemen, as I conclude, the Zimbabwean Society of Obstetrics and Gynecology, you are key and you are central to playing the role of convening us, not just for guideline development, but for interrogation of relevance to our context, relevance to our priorities, relevance, particularly now with dwindling resources. What can we do as a collective to make it better? The more women, more newborns, more children, more adolescents are saved. This is my plea to all of us, and really want to thank you for this opportunity to share just a few of my own insights. Thank you.
Thank you very much, Prof. Kihara, for your words. Please note that we shall be sending our gift to you via Kenyan Airways. And yeah, we also appreciate your patience. You know, you've been online for quite a while, so we are really grateful for that.